So what is a sudden hearing loss? So sudden sensory neural hearing loss is a very unfortunate incident that happens in any patient, and it happens within a period of 3 days, and the patient progressively loses hearing on one or both the ear within 3 days of time. So this is a medical emergency and ideally should be treated within 3 days of time. So this is a period where the hearing can be salvaged. So this will be treated by intratympanic injection of steroids, wherein behind the tympanic membrane we'll inject the steroid, which will reduce the inflammation of the hearing nerve, the auditory nerve. So this is followed up or in adjunct with oral steroids. So the cost is mostly idiopathic, but there are certain triggers like a vascular infarct or autoimmune condition or underlying any cerebellopontal angle tumors. So if a patient comes with a sudden hearing loss, the first step we do is do a hearing test, and we do 3 consecutive hearing tests, and if the hearing loss is at least 30 decibel, that is when we label the patient as a patient who has got sudden sensory neural hearing loss. And this is followed up with intratympanic steroid injection. That is what we are going to do today. And this again is followed up to 2 to 3 sessions depending on the hearing improvement, which means we'll do serial hearing testing and decide whether patient needs 1 or 2 more course of intratympanic steroids. So how successful is this procedure? If the patient presents within 3 days of hearing loss, the success rate is almost 100%. But after 3 days, the result is tricky, wherein there will be definitive improvement, but we cannot for sure say how much percentage of improvement will be there. So we'll proceed with the procedure and we'll see what happens. So we do local infiltration using topical anesthesia is attained by placing 4% lignocaine dipped cotton balls kept in the EAC. The trick is not to push the cotton balls too much, because that would be counterproductive, and the tympanic membrane will be slightly bulged, shifted inwards, will be retracted inwards. So the trick is not to place a cotton ball under tension. Now we wait for a few minutes for the topical anesthesia effect to work. Sir, are you doing fine?
Yes, ma'am.
Okay. So this would be the eardrum or the tympanic membrane, and we are going to inject in the postero-inferior quadrant, and we have to be very confident and not create a iatrogenic perforation should not be created. So you can see the bulging of the tympanic membrane. You can see the tympanic membrane is bulging out. So now it's coming out. So I think I should stop here. So I will stop here. Now the EAC is being filled, which is fine. Sister, we need a so you can see the small blood clot at the level of where we've created a opening, that will seal the defect with a small advil. Yes. And air fluid level here there is a horizontal level, so there is fluid inside, which is nothing but the steroid that we have injected inside. Mandatory step, but I would like to do it because we don't want any post-operative complication. So I seal the defect with a small Advil in that area. So try not to move. So can you hold your breath for 3 seconds? So the defect is sealed and you can see air fluid level behind the tympanic membrane. So the middle ear is filled with the steroid and the defect is sealed. So this is the completion of the procedure. We'll do serial post-operative hearing test to assess the improvement.